Good morning, everybody. We got a fun topic. Today we're going to talk about kids. We're always trying to figure those out. I see those questions a lot. What do I do, right? So, all right, letting some people in. As always, I like seeing people's faces. It's great to see. I have a bigger screen now, so I can see more faces at the same time. All right. And if you have questions, you can certainly raise your hand. You can put them in the chat. I do try to get to everybody. We're gonna make the screen bigger. There we go. All right. Lots of people joining. It's good to see everyone. I have a new camera, so hopefully it doesn't fall off. It's stuck with a little suction cup on my screen. So if it suddenly falls, you'll know what happened. I didn't fall. All right. People coming in. Anybody else dealing with the forest fires of Canada? Those of us up here in the Midwest are dealing with it a lot. It does make for some really pretty sunsets, but it's bad.
No, we just have killer heat in Texas.
I've heard that Texas has decided you want, to fry things on it, eggs on your sidewalk every morning. I don't know what's going on down there. We're supposed to be there. I will be there at the conference the last Sunday, Monday, and Tuesday of July. And this July, I'm like, none of us are leaving the outside. Like, we're all going to be inside in the air conditioning. There's none of this. Texas is trying to kill people. It's like you're copying Australia. If you had the dangerous animals outside of rattlesnakes, then you'd be Australia. Just let you know, I resent out the invite because I was just showing you what July's things are going to be. Next week, 4th of July, if you don't make it, I totally understand. They will be recorded, but it'll be the Thursday, obviously, after the 4th. We have a guest speaker. Joshua George is actually one of my agents, and he's my baby brother. He works for me, and he does a phenomenal job. There he is. He does a phenomenal job at dental, whether he wants to or not, he just does. He got into dental because it is absolutely like the #1 thing people ask for. And if you're not asking them, all right, I got your health cut done. Would you like dental? You're just missing out. You're never going to make a living selling dental. You're not. But there's a lot of good reasons to do it. It opens up the conversation for other things besides dental. And that's when they will start to click in their head, your client, that, oh, this agent does more than just health insurance. So even just by saying dental, they may go, do you do life insurance? Yes, I do. Do you do, I heard there was cancer, or they tell you what their employee benefits were. So especially if you're working with retirees, that's kind of our niche, is the people who want to retire. Ask them, what was your employee benefits? They may tell you, oh, I had this, 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 and this. And you can go, I can get you all that back. So don't be afraid to ask for dental. And so we're going to talk about that next week, just why you should do it, kind of how Josh's brain works. For those of you who like numbers, you might go, oh, okay, I can see where you're coming from. And then we're also going to talk about kind of how to handle it when somebody's group coverage is ending in the middle of the month. It's not a hard and fast rule, but just some general guidelines, best practices, refunds on those premium payments. When does it happen? When doesn't it happen? And what to do when the client's behind on payments. This comes into play at the end of the year. I love seeing these faces. When somebody is behind on their payments in November and you're enrolling them for January, you kind of need to know what that means. So we're going to talk about that. We are going to talk about newborns, how to handle them, because that one is another one that's just odd, right? And I want to make you, oh, you got air warnings in New Jersey, Jessica, that's crazy. I do want to warn you that I'm trying to make it efficient. That is how I do it. Why? I don't want you to spin your wheels when there's a much faster and easier way with children. When they're born, you don't need a bunch of proof that they exist yet. Just get them on the coverage. I've only ever run into, I used to have a kind of a webinar that was like trick the expert, and I wanted people to bring me their weird scenarios that had come up to see if I had an answer. And I had one that I kind of knew the answer and I couldn't fix it. A child was born in December and they didn't tell the agent until February. And I can't backdate last year's. You can't do anything with last year. So that one had to go to the marketplace. But just kind of how to handle when you've got children. All right, I think we got a good chunk, about 5 minutes in, we got 53 people on. This one is kind of complicated. So I'm doing the not bare minimum, but that's kind of what I'm doing. This is going to be more of a lecture. I will send out my notes to you when I send out the recording so that you can kind of see the notes again, see what I'm doing, what I'm talking about. So this is a little bit more of a lecture than other times because it's complicated and I'm not going to be able to hit every unique scenario that can come up. There's just no way. But I think what my plan is, I'm hoping that you're going to understand the why behind some things so that when those unique scenarios you can come up, you can go, all right, I think I have a why. If you think you know, the scenario comes up and you're like, okay, this is the situation, here's what I think is the solution, you can certainly send me that as a message on Facebook or shoot me an email. I'll be happy to go, yep, sounds like you're on the right path. Or, hey, here's this weird, odd situation about that you have to be aware of. On this call, I've got 54 people now that have added. How many of you have started to realize that this is very different than Medicare? Right? I mean, it's very different. If we were brand new Medicare agents to the brand new Medicare, okay, I think it's celebrating 58 years. 58 years Medicare has been around. They were just as confused as we are right now with ACA. They were just as people were up in arms. Why? How dare you take my money? Okay, how dare you require this? There was a lot of angry people, believe it or not, when the Medicare was passed. And now, of course, if you tried to take it away, there'd be old people in the streets with, pitchforks. And now, so we are in that flux with ACA. The government threw some stuff together going, this kind of makes sense. And they threw it out there and they didn't really coordinate. If they were coordinating with the rest of the government, Social Security and IRS, this would make life a lot easier. One of the things I've noticed, you enter in somebody's Social Security, but they tell you they're getting $1,200. And in reality, they're getting, $1,372, but, they're getting a tax credit. It would say, send us proof of income. You're like, oh, okay, we're off by $100. If the system was smart, it would not just go, hey, that what we see on the Social Security is 1,372. It would just autofill it, right? That would be like, okay, the system's working. You put in somebody's name, Social Security, you get to the income and boom, it would already be there. Here's the gross amount of Social Security. So it's not a smart system. This is still trying to figure things out. So I want you to remember that when I start telling you about some of the family stuff. So college kids, they're the easiest. If they are in the same state as the parent, when you go into the application, every person, it says, do they all live at the same address? The answer is no. So if the kid is in a different, if they're in the same county, no big deal. But if they're in a different county, say no, that child is living somewhere else. Put in the child's address. So around here, Madison is a really big one. We have a lot of kids that go to Madison. So I will say the parent lives in Duluth and the kids are going to Madison. Once you finish the application, it will have them split. It'll say, all right, pick the parent's plan based on their county. You click it, and then it'll say, pick the plan for the kid. So it's really easy. It will be 2 different paths. I kind of let the parent or college kid dictate it a little bit. The first thing you have to have them do is find out, does the college the kid is going to have coverage? Most of them do nowadays. or they've got a clinic, right? They've got something for those short things. So if they're like, yeah, my kid's really healthy, they never go to the doctor, and we're going to have them have their annual when they come home for summer, you can say, all right, do you want me to put them on your plan here and they're going to stay with their family doctor? Then just be aware, outside of emergencies, they're going to have to come home for everything. If they're a sports kid and they blow their knee out in college, they're not going to be able to get treatment for that there. They're going to have to come home to get treatment, or would you rather they stay there? And some kids are like, they're in college, but they stay there, right? They have apartments. They really aren't coming home. So then let the parent decide. If the parent says, no, they're going to come home, okay, technically their residence is mom and dad's. Or no, you know what, they're going to stay there. I want them to be able to get doctors there. Or maybe they have a counselor. They do mental health and they're going to see that person every week. Well, then they need to have coverage where they are. So first, find out if they have coverage at college. Second, decide, do they need the coverage where they're at, or if they need coverage at, if they need to be on the parents' plan, because they're not going to go to the doctor outside of emergencies there. So that's if they're in the state. If they're out of state, same thing applies. You need to find out, one, what the college has for insurance, and or if they have a clinic. Then that's where it's a little tricky. If they're just going to college there and coming home, then you actually do need to put them on either their mom and dad's plan, understanding it's only going to cover emergencies out of state, or decide that they're not a tax dependent and they're going to get their own coverage out of state. So somebody asked a question. Let me get over there. Where is my mouse? I don't even know what it's doing. There it is. So would putting a college kid at a different address be a conflict? Nope. Remember your IRS. Do they ask you where's everybody's address when you fill it out? Nope. It just says, who's your tax dependent? So as long as they're a tax dependent, it doesn't matter if they're at a different address. If they're in a different state, it doesn't necessarily mess with the tax credit, but that's where you have to decide. I'm in Wisconsin, my kid's in Maryland. Well, are they going to come home for emergencies? Is it worth being a tax dependent? Maybe that Maryland college has insurance. Buy the college's insurance. A lot of them do have insurance you can buy. So you really have to figure that out. Some colleges have campus clinics. A lot of them do. Some of the big ones, the state ones, yeah, they have college clinics. So, all right, if it's something really short. Having a child no longer tax dependent, would that mess up student loans? Not the student loans, no. Student loans are somebody's co-signing. It doesn't matter if it's dependent. So if they're out of state, it's, again, the ACA hasn't caught up to that. We're at the beginning stages, even though it's been around for 10 years, it doesn't catch up to that. That's why kids are kind of the ones that gets weird and lost. So if they're in the state, decide, are they going to stay on mom and dad's plan in their county, or do I put them in a separate address? And then they're going to be in two different plans. And then when they come home for this summer, all right, I take them off the college one, I put them back on with mom, unless they've reached their max out of pocket, they're going to be going back to that college in the fall. Yeah, okay, I'll just keep them there. So correct. So the college kid from another state, parents think, yep, he's there. A lot of time now, if your kid is hurt paying for the college sport, the college is going to cover it, but it's not usually major medical. So they do need to check that. You can get different coverage in a different state, but not on the same application. The marketplace is not smart enough. If you say the parent lives in Wisconsin and then you put a kid in a different state, it's not going to let you find that kid. You would have to do a completely separate application in that state. Now, you do have to pay attention, like Ambetter in the South, it's in a few states. That one does cover multiple states, but Anthem Blue Cross does not. Anthem Blue Cross is a franchise. So, this is, and I know not all states do short-term medical. There's a lot of states that don't, but guess what? Short-term is covered in New Jersey. It's covered in California. If I bought the short-term plan here in Wisconsin and my kid went to California coverage, it covers them. The short terms cover you nationwide. So you use mom and dad's address here where their technical residence is. They're just in college. It's not really a residence. It's like a temporary address. The short-term bought in a state that covers them will cover them. Correct. Short-term colleges, you have to find out what the college is requiring. Some require credible major coverage. Some don't. All right, we don't have enough time. We're gonna, like I said, I can't get into every single situation. I'm gonna get into now tax dependence, because that one is really, that's the other one that's a little bit tricky. So a person has a child that is not going to be on their health insurance, but they are a tax dependent. All right, example is, oh, I got some people coming in. The example is mom and dad's divorced. This year, it's dad's turn to claim the 2 kids, but the kids are on Badger Care under mom, but he gets to claim them. Wonderful. So you go into the application and you enter those 2 kids' names, dates of birth. You don't have to do social security numbers if they are not getting coverage for children. For spouses, you do, otherwise it causes issues with income. But for children, you don't have to put that social security because they're not getting coverage. Put the children's address as the parent that you are enrolling. Do not say they live with another parent. Don't, it's irrelevant. This is where you have to remember, this is not health insurance. This is IRS thinking. The IRS doesn't ask you when you say, I have 2 dependents, it doesn't say, where do they live? It doesn't care. The IRS does not care where your children live. The IRS cares who is going to be on your tax form. So remember, when you're filling out this application, you're not really filling out a health application, you're filling out a tax credit application. You're filling out the credit for the tax credit, which is going to connect to the IRS when they do their taxes. So when you do the rabbit hole of putting in the parent's name, the other parent, and trying to do their address, it doesn't do any good. It leads you down a rabbit hole that doesn't help, and sometimes can hurt, because then it's trying to get you to get all this information, and it's irrelevant because you have to remember IRS. Now, this may change as this gets more worked out, as they try and figure things out, but most of the time, you just keep them on the parent. They're not checking in. The health company that you said, that's covering the 1 adult isn't going to go to their house and go, hey, you said you had 2 dependents. Where are they? I don't see them living here. So remember, IRS, you want to keep this as simple as possible. In fact, never say they're living with somebody else. No. You have to figure out, when somebody comes into your office, this is part of that fact finding, and it says, I got to cover my kid. Now we're talking about when you have to cover these dependents, because it's a divorce decree, because that's just their arrangement. These are the things you need to do. So you need to figure out what the goal is. Do they have to get the child covered by insurance? So find out, 1, is there an alternative? Does the other parent have employer coverage? Could they go on that? Does the parent that you're working with income and the other parent's income qualify that child for Medicaid? If the child's already on Medicaid, you can't put them on the marketplace. So you really have to do some fact finding. And can the child be claimed on the taxes of the person you're working with? And here's the big one. Are the parents friendly or hostile? I mean, that's really going to help dictate how this goes, right? You're going to have 2 parents that, all right, they just didn't get along as husband and wife, but they work together, right? They're like, no, whatever is easy. I'll just talk to my wife. I'll just talk to the mom. They'll do that. All right, that's going to help versus absolutely not. I am not talking to that person. All right, you need to figure those things out first. After you figure it out, and the parent that is coming into your office or on the phone with you, there is no way that child is going to go on the other person's carrier employer plan, and they are not going to get to claim that child. All right, it's just, all right, it is what it is. This is what you do. Now, assuming inside the same state. I'm going to pull up my Health Sherpa so that you can see what I'm going to do. This is the easiest way to do it. So assuming they're inside the state, let me share my screen. So here's my marketplace insurance or my Health Sherpa. All right. I put in the zip code and I run the quote for the parent. And I'm going to say my example is a parent, there's 2 kids. He gets to claim this one today, or she, the gender doesn't matter, gets to claim one of the children, but has to cover 2 children. Run the quote. So my example, it's a family, parent is 35 years old. The child they're claiming is 4, and they're going to make $45,000. All right. So I look down, I do my due diligence, and the plan they're going to take is going to cost $61.85. That's their tax credit, $60.85. Okay. Now, how much does it cost for the 9-year-old? So we come back up here, remove the parent, put the age at 5, and get rid of the income. So the exact same plan down here, $219.39. So I'm going to add that up, $219.39 plus the $60. So now it's going to be $280.24. And the parent goes, okay, I can afford that. It is what it is. I have to do it. My child has to have coverage. I can do $280.24. Sometimes they see that rate, and that's when you find out maybe the relationship is amicable, and they go, yeah, that's more than I can do. Let me go talk to her. Let me go talk to him. But they say, for this example, they're going to say, yep, I can do it. $280.24. It is what it is. I'll do it. So then you go into the application and you run it as if they're both tax dependents. Put both of them on the insurance or on the application, say that you're claiming both, say they both live with you, and then at the end, take less tax credit so that they are paying the correct amount. They are paying $280.24. The IRS goes, they're good. At tax time, when they file their taxes and they really only had 1 tax dependent, and we had listed 2, the IRS goes, hey, you should have been paying $280 a month. Oh, you were paying $280.24 a month. We're good. The kid had insurance, the IRS is happy, the other parent is happy, their kid had it. That's how it works. You have to think IRS. Everything is reconciled by the IRS, not the insurance companies, not healthcare.gov, the IRS. Now, if they're in separate counties or separate state, separate counties, you're going to have to, all right, where do they go to the doctor? You can do that, lives at a different address. It'll give you the option for the other address. If they're out of state, that's when it's just tricky. That one, you have to either do the full cost in another state, you create another application, put your, the adult doesn't get coverage, don't enter any income, and just pay the full amount. Or you can look at short-term options. There are other options to look at. Those are going to be tricky. The system is not smart enough to do that yet. It should. Hopefully, eventually, one application we go, yep, I have a kid who's in California and another one in New Jersey, and I live in Texas. And then at the end, it's going to pull up your 3 different options. But it's not smart. The system isn't there yet. Unfortunately, it just isn't. So you have to think outside the box. You have to manually do it what it should do for itself. So I got to make an application in New Jersey. I got to make an application in California and then one in Texas. You can find agents. Hey, who's got New Jersey? Who's got California? Here's what's the situation. I need a kid in California covered. Then the divorce decrees, a lot of them are not, judges, they don't know this. They don't have any idea how this works. They just go, hey, so-and-so who made the money, you should be covering your kids. And as we know, it's usually the father, not always, but usually the father. I had one where he barely made a living. He was like this much above qualifying for Medicaid himself and was court required to cover his kids. And they were already on Badger Care because she didn't make any money. And I'm like, well, I can't put them on the marketplace. So I had to do some thinking, and what we ended up buying was getting, and I looked at I'm like, bring me your papers. I need to see exactly what it said. And it said health coverage. So we got him an indemnity plan. It was ridiculous. The Medicaid was already covering 100% of everything, but he had to have something. So he got a indemnity plan. And I go, all this means is if your kids actually go to the doctor, you're going to make some money. The indemnity doesn't have anything to pay, but he honored the court documents. So this is where you have to kind of see, you're gonna have to do a little digging. This is where contracts in other states are helpful, or contacts, whether you want to contract or contact somebody. So I'm gonna go over here and look at my questions because
Hello, can you hear me,
distracted.
Erica? Oh, it's Jason Cetri returning your call from Florida Family Benefit.
Jason was talking to all of us. All right. So, I'm looking at Sharon, asking the question on ask if everyone lives at this address, because the out-of-state claim dependent wasn't applying for coverage. Right. If they're out of state, if the dependent is not getting coverage, you don't need to enter anything beyond that they live with the main person. Because remember, this is for the IRS. They just need to see how many people did you say was a tax dependent on the application. You said you had 2. When you file your taxes, you have 2. That's all the IRS cares. The IRS does not say, tell me where your tax dependents live. They don't care. IRS, you got to keep thinking, IRS, what is the end goal? What does the IRS need to know? They just need to know how much you made and how many was on your, how many dependents. Sharon, I have 2 kids on their college health insurance at 2 different schools, and they work great. They're not rolled into any loan, pay for separately. Yep. There are some college loans that are great. There's some that's not. The parent and or child needs to look into those college. Brian, Christine, or any other knowledge person, what's the easiest way to buy a health Sherpa to add a spouse to an existing application? Just go in there and hit update. Find the application, hit update, and then just add them. It's really easy. You walk it through. And they'll be enrolled for July 1. To make sure it starts for July 1, they need to say losing coverage by 6/30, and then it will start 7/1. Could you put a child on a child-only policy off the marketplace? Sure, you can do that. You can do a child-only on the marketplace. If doing a separate application because the child is in a different state and you do not claim them as your dependent, and the child has their own policy but no income, how do you handle it? That's fine. So are you doing this as the child if they're a dependent or not? If they're a dependent, then they're going to be part of the parent income. If they're not a dependent and they're in a different state, and then that's going to be a little bit different. They can also look at the state Medicaid program. Every state is different. So that's where, is it worth them being a dependent? Maybe if they're dependent, they can't be on Medicaid, but now they can go on Medicaid because they're not a dependent. That's going to vary state by state. If there's more than 3 minor, rates are the same. Plans only charge for 3 dependent minors. Yeah, if you've got a bunch of kids, the rate is what it is. And I've seen people where because they made such low income that even when I subtracted the tax credit, they were still paying a very nice, very affordable rate. So it's going to depend on the income. When a child and parent are in different counties, I pick a plan that is in both counties to make it easier. Correct. You can do that. If the insurance company covers both, you have, Joe Blode Insurance Company covers both of this hospital and this one, and they're into, okay, yeah, you can pick the same carrier. It's when they're living in separate areas completely where there isn't the same carriers. You had child was covered on Medicaid in another state, but the mother claimed as a dependent. He couldn't afford ACA, so he added a super high deductible short-term plan just to meet the criteria. Yep, it's really, like I said, the divorce lawyers, the divorce courts haven't caught up to this. I would love to get in front of some divorce lawyers and explain how this works, and some divorce judges. Really, it's the judges who make that decision so that they can understand how this works. And by the way, this is my only legal advice I've ever given somebody who is getting divorced. is not to have their, basically their alimony and child dependent rolled into one thing called a house. It's got a term for it, because if that happens, the child support is rolled in, and now the person getting that has to claim it. You want that separate. And I don't think her lawyer knew that, because then it ends up affecting the tax credit. Couldn't the indemnity plan knock the family out of Medicaid? Nope. They couldn't, because it's not counted as income. Money you get from an indemnity plan, life insurance, those are not considered income. So no, it wouldn't kick them out. And the policy was written under the father, not the mother. So it wouldn't have affected it anyways. You just gave an example. Does the child have health insurance in 2 states? So like the short-term option and the Medicaid? Yeah, you could. California can only do an ACA child if the child is over 18. Well, then that's not a child, that's an adult. So again, state regulations are different, but that's not a child only. That would be an adult, so they're over 18. Does the college kid have a job and will file a tax return? Yeah, if they've got a job. I mean, I've had parents who are like, you know what, this makes sense. You know, let's take the example of a couple that makes $100,000 and their kid makes $14,000. I go, well, you could put them in your plan. You're really not going to get a tax credit. But if he's on their own plan at $14,000, they're going to get a cost sharing reduction plan that's amazing. And they go, oh, well, they're maxed out of pocket $1,700. Perfect. He's not going to be my tax dependent. He's going to go on his own. So you can do that. That's where you really need to have that conversation with the parent. You really need to understand that. And now, of course, remember with CMS rules and regulations, the child also needs to approve you for doing this. A minor child can have their own policy in the marketplace when they do not qualify for Medicaid. Yeah, absolutely. If you are not putting the parent on, though I don't know how, if the parent has insurance through a job and they want the kid to be on the marketplace by themselves, sure, if they don't qualify for Medicaid. Yep. Why did the health Sherpa not send them to Medicaid when you put in 0 income? College different, planes. I don't know. I don't. Just because Health Sherpa sends it to the Medicaid system doesn't mean the Medicaid system is going to accept it. They basically go, hey, we think you might want to look at this person. In fact, if you accidentally send somebody to the Medicaid system, that you have to tell them, hey, pay attention to the paperwork. If you say that they got denied Medicaid, it's not gonna send it at all. It doesn't compare anything. So I don't usually put 0 income and get it to the Medicaid system unless somebody really wants me to do it that way, in hopes that the Medicaid system gets them first. College kids in different county playing sports that college won't cover. So they will cover it if they're paying sports for the college, but if they just get hurt playing flag football up front, they're not going to cover it. That's why you separate them. You put the college kid's address as separate, and then it's going to show you the insurance is in that county, the insurance options. If agent broker training explains things like this, we would all be further ahead. That is correct. But even FMOs across the country, I can think of about 3. Most of them are still ignoring the ACA. I don't know how many CRMs you have. I have Agency Block. It's a pretty decent CRM. They've got some amazing things coming down the pipe, by the way. First quarter, they got some awesome things, all for Medicare. And I'm like, all right, I need to talk to your developers. Like, I'm here, and you know what? I need more help than the Medicare people. Yeah, they've got the scope of appointment, and I get it. It's a pain in the butt. They have to get that every time. But I have to talk to every single one of my clients every single year. So the ACA is still a little bit of the redheaded stepchild that is slowly being invited to the family. So it would. I wish there was more training. That's why I do this every week. That's why I created a training platform that I talked about last time, that I go into great detail of these things, a lot more detail. I've been doing this since 2013, and I am not afraid to push buttons. What does this happen? What happens if I do this? I did it with my own self when I was experimenting, when I was on the marketplace. So yeah, it's, sometimes it's not beneficial to have kids on your plan. If they're got a part-time job and they're going to make 13,000. Hey, or 14,000, I think now it's up. I'm going to put them on their own plan. You show that to the parent and they're very happy. You also get the parent who comes in insisting that they can keep their kid on their plan until they're 26. That is correct. You can keep them on health insurance. Doesn't mean you get a tax credit, right? And then I show them, I'm like, okay, the kid is 24 years old and makes a $50,000 job. It's time for them to get their own health insurance. But if you will have those parents who will resist because they will remember, oh, I can keep them on until they're 26. Yes, you can keep them on your employer's plan until they're 26. And while technically you could have them on this plan until they're 26, you can't get the tax credit for them. And then they go, oh, you kind of show them. And then you go, okay, here's what the plan is for the kid by themselves, especially if they're lower income. Hey, my kid works at the Humane Society and, makes $15,000 a year. It's not even worth them being on your plan. It's better that they're on the other plan. If you leave the income portion blank in the quote, it just assumes you aren't looking for tax credit. I just don't. There's a spot at the very beginning of the application that says, do you want to enter income? Say no. And then it doesn't even ask. Boy, that application is quick. It just asks for name, date of birth, address, social security number, and that's it. It's really quick. So you don't have to enter income. You can just click, I don't want to share my income. And Mindy, I don't know, I've never just left it blank. If I'm not going to enter the income, I just say that I'm not entering that. What if the kid on the parent's plan makes more than the parent? So there's two outcomes with that, and we are definitely over time if people need to go. If the child is going to make more money and they know this in the middle of the year, let's say they're graduating in May, right? And they get a job in June, and now they are really going to be on their own. They're going to make decent money. The sooner you get them off the plan, the better. Have the parent should call you up going, all right, I had a lady call me. Take my son off my plan right now. And I'm like, wow, okay. She goes, yeah, he graduated. He just got a job. He's making $120,000. Oh, yeah, we need to get him off, right? So, and then he called me and we worked with what he needed. But the parents needed him off. They did not want his income because it would have messed up the tax credit. Yes, they did have to pay back some of the tax credits when they had a family of 3 listed for the first part of the year, but it was significantly less than what they were going to have to pay when they had their son's insurance. And this was back when there was that cliff. So you can change, you can kick the kids off at any time. If they get a job in October and they were in college in, up till May, are they a tax dependent? I don't know. I'm not going to give that advice. I'm going to tell them to talk to their tax accountant. You better go talk to your tax accountant. Find out, right? Are they or aren't they? Because I don't know those rules, regulations, they change. IRS rules change all the way up until, believe it or not, in February and March of the year that you have to file. So I'm going to put that on them. I mean, I have my own guesses, but people have still come back from their tax accountant with things that I'm like, wow, it's like magic. I didn't know you could do that. So if they're going to make more, I would take them off. Let's get them on their own plan. Now, it does happen at the end of the year. The kid made too much money. I don't know how this is. I just tell accountants this. There is a way to somehow separate them so that the tax credit goes on the child and the tax credit of the parents. And because the child is younger, the cost of their insurance is younger, somehow the tax credit gets put on the child and they have to pay less back. I have no idea how it's done. I'm not an accountant, but I know an accountant who found this because of that SAC situation where the kids suddenly made too much money and they needed to separate them. So I've told other people who then told their accountant and they figured it out. They found a way to do it. But I don't know how that is. It's much better if they tell you ahead of time. Confusing different day, run a situation too often with single mothers. When I enter the application plus the dependent, child is usually sent to CHIP. They're automatically sent. If you absolutely know that they're not going to, so my state will sometimes say possibly, and it'll send them to Medicaid. This actually happened my first year way back in 2013 with myself. And then the state came back and said, no, they're not. And my child had no insurance for two months. Now, I had a healthy kid, I didn't need it. But that's when I started paying attention to my state Medicaid program. If somebody comes in and I know that they're not going to be accepted, especially right now that the rollback is happening, if you click the button, denied Medicaid, it doesn't send it. It just doesn't. It's not going to compare. It's not going to go, well, maybe they should be. It just isn't. Again, it's a glitch in the system. They might fix that in the future, but for right now, if you say denied Medicaid, it keeps the kids on the plan. Now, if you get to the end of the application and it says, send us proof that so-and-so is no longer on Medicaid, that means they have it. They may have not wanted their kid on it or whatever, but they do have it. But if they've never been sent to the Medicaid system and you say they're denied, it just adds the kids to the policy. They're missing 1095. You can get that on Health Sherpa. That is, now you're not going to get back from 2020 or 18 or something, but on Health Sherpa, you can pull them into your thing and they can get it. They can also, if they have the healthcare.gov account, they can do that. So yeah, Brian, keep thinking the system's smarter. I can't tell you how many times you need to tell yourself this system is dumb. I tell my clients the system is dumb when it's asked if the 3-year-old girl is pregnant, right? If it asks if the 10-year-old is married. If this was a smart system, I don't think it should ask if it's the ages of children where it's illegal for them to be married if they're married. It's not a smart system. And it's not going to ask if a 3-year-old is pregnant, right? I mean, I loved it one time. It was a baby. I think they were 3 months old, but because it was a girl, it says, is this one pregnant? It's not smart. The people who created this program did not ask how the real world works. They didn't ask how the other systems work. And the system is still as antiquated as it was. As fancy as Health Sherpa is, Insura and all the third-party vendors, it's just a frilly fancy covering. They are all bound and dictated by healthcare.gov. And of those of us agents who did this in 2013, 14, 15, and we know how stupid and asininely just crazy that application is, it's still the same. It's still the same chassis. I don't care how fancy this car looks. The engine in it is a Model T. Okay, this old crank up. It's an engine that is not as fancy as you think. The outside looks fancier, and Health Sherpa has helped a lot. They've changed some of the wording on some things to make it a little clear, but that's where you become the expert. You get to tell them what the system is really asking. This is what it really means. It's not smart. It really is not a smart system. And now state exchange, those are their own thing. I can't really do that. As for the date denial, that kind of stuff, I don't know state exchanges. That's where if you work in a state exchange, start going to any kind of networking event with insurance carriers and find the agent who's been doing it since the beginning. Find the one who's played around with it, because that's going to be the one who's going to help you. Because yes, I know, Jessica, it makes you a little uneasy because now you're in the States, but I don't know how state is. I just know how the feds are. And the Fed doesn't, they don't care. They just want to know at the end of the year, the IRS goes, what did you make? How many dependents? And what did your application say? That's all they care about. They don't ask what county you were in, right? They don't care. So think this is a stupid system. It's going to get caught up, good, bad, or otherwise, eventually. Now that it's here to stay, it's not going anywhere. You're going to get people concerned during open enrollment about the election and what happens. It's not going anywhere. So don't, I mean, I remember people thinking Medicare was going to go away because of President Obama was leaving. I'm just like, wait, what? Even if it goes away, I think Josh had somebody yesterday said in 2 years, what happens if this goes away? I don't know. We'll deal with it in 2 years, right? It's not going away. There are some states that are doing some interesting legislation about state exchange programs and full, basically insurance for all through the state. And we'll see what that happens, and we'll learn and adjust. But, don't let clients, just be the voice of reason. Yeah, there might be a complete changeover in the House. This isn't going anywhere because there isn't anything better at this point. The ACA needs to be fixed. There's things that need to tweak it. And as agents, we all know the system is what they need to fix first. Could they just give it an engine, make an application that makes sense? But in the meantime, use that to your client's advantage. Find the ways around. Sometimes you have to make it, you have to manually do it what the system was meant to do. Thank you, everybody. I will send out a recording and kind of my notes. I hope this kind of cleared up some things. Again, if super detailed questions, let me know. Otherwise, thank you very much. Have a wonderful rest of the week and a happy 4th of July.
Thanks, Chris.
You're welcome. I'm